Just this week, I had a call from another friend in the restaurant industry who said, I realize we're not ready in the restaurant industry to reopen today, but you've got to get other stuff open. Just open it up. And I said, well, like what? What are you talking about that you'd like to see open? They said, let's build something. Let's reopen construction. Well, I want you to know, look at this list. Health and public health operations never shut down. Construction never shut down because you can physically distance on a construction site. Our manufacturers never shut down, and they were responsible in their practices in their manufacturing plants. And down the line, delivery and takeout, grocery stores, pharmacies, essential retail, gas stations, hardware stores, hotels and motels, car dealers, auto mechanics. I asked people to be healthy. They've been out in our state parks, hiking and running and walking. A lot of the folks in the media didn't like that golf courses remained open, but there's no place that's easier to physically distance than in a golf course. Our charitable organizations have remained operating and doing a great job. Goodwill, the media, of course, has remained open along with banks, credit unions, critical trades, postal services, laundry services, and at our last meeting, elective surgeries were reopened. So I want you to know, as much as we need to turn the dial and brighten our economy has not been completely darkened. There has been some energy and revenue flowing through it. That's been part of the gradual, responsible, and balanced approach, and that's what we'll continue to do going forward, step by step. So the next step in terms of breathing life back into small businesses is we're going to bring back a small step in terms of a revival to Main Street with a partial reopening to retail. You'll see this beginning on Monday, May 4th, and expanded on Friday, May 8th. It will be voluntary. We've learned a lot from our big box operators, our Costco's and our Targets, our grocery stores, our Fry's and Safeways in terms of how to socially distance. We're concerned most not only about our most vulnerable in public health, but our small and medium business owners. And this will be a way to allow them to participate in a safe and gradual way. There will be more details on our website and ArizonaConnected.org. I also want you to know that we have a goal. We're planning ahead in terms of what we want to do. Next week, you'll see a plan that's going to be released, informed and in cooperation with the restaurant industry. We're working with the Arizona Restaurant Association and Steve Chukri within CDC guidance so that we can begin to expand dine-in. Our goal is to do this sometime in May. We are aspirational at this time. The best case scenario, according to the industry, would be on May 12th. But it will have to be in coordination with the industry and public health. Our goal is to get this open in May. We're working with the leaders in the industry for best practices. A lot of people are talking about a new normal that's going to happen going forward. I'd like to think of it more as a temporary normal. And when you do walk in to one of those opened restaurants for dine-in, it will be a different experience. It'll be a temporary experience with food service workers and service workers wearing masks. Rather than coming to your table and asking you what you'd like to drink, they'll likely inform you that they've just washed their hands and ask how you would like your food delivered, et cetera, et cetera, et cetera. But a best case scenario on that is May 12th. We're going to work with the industry and we'll have best practices going forward. Now there's a lot of discussion around testing. And We've done nearly 70,000 tests to date in Arizona. I think it's 69,077 we reported today. We need more testing. We need diagnostic testing and antibody testing. We're going to have a blitz this weekend in partnership with our community labs to rapidly increase diagnostic testing available at drive-through sites. I want to thank the partners, Banner Health, Walgreens, and others that are stepping forward. What this test will tell you, and these tests have been prioritized to people that were symptomatic or sick, and of course our healthcare workers. It's now being expanded. Dr. Christ has issued a statewide standing order allowing anyone who thinks they are infected with COVID-19 or has been recently exposed to COVID-19, you can be tested. And we will have available tests, thousands and thousands of them this weekend. So if you're in this category, if you think you are infected, if you think you've been recently exposed to COVID-19, please go to azhealth.gov/testing blitz and sign up to be tested this weekend. And what this diagnostic test tells you is if you are sick right now. It tells you if you have COVID-19. You could wait in line, get this test, leave your car, open up a door of a public building and contract COVID-19. So it's not only about finding out if you're sick, we of course want to continue to prevent people from getting sick. But that's the testing blitz.
As we look at long-term care facilities, these are residents. These are their homes. This is their address. There is state law that requires me to protect people's communicable disease information, and I take that job seriously. If a court of law decides to disagree with the department's interpretation of what type of information we need to protect, I will happily release that. But I've got a lot of communicable disease data, and I don't think people want their home addresses released with that data.
Well, Dr. Christ, we have talked to multiple HIPAA experts nationally and here in Arizona that say it is not a violation of HIPAA in any way whatsoever. And furthermore, you've invoked your grandmother a number of times, Governor Ducey, and I just spoke with a woman whose father is in the ICU on a ventilator, and he was in a long-term care facility. Another resident, his neighbor, actually passed away this past week after contracting COVID at Westchester in Tempe. And she tells me, she actually has pulled her father's in the hospital, but she says, when I have to put him back in a facility, I want to know which ones had 20 deaths and which ones had 0. And she thinks she has a right to know that, and that would guide her decision. So what do you say to these people who have to place their parents in a facility or are scared about the numbers?
Can you talk about the procedure and how we're handling that?
Sure. So what we would encourage for any facility that you are looking at putting a loved one in, we would recommend talking to the administration. So we have developed letters that they can use to send out information to residents, their families, their guardians, letting them know, because they are the ones that are impacted, if there is COVID in that facility. We would take, this is a very vulnerable population, and so, and this is a very dangerous disease. So I would not rank the number of deaths in a facility and use that against the facility, because this is a very hard disease to treat in this population.
Let me ask a very specific question to that. So does that mean, certainly if my mother is in, as the governor knows, my mother's in a facility, they will tell me. If I want to place my mother in a different facility, do I have the right, and do they have to answer how many cases they've had in that facility?
So I would talk to the administration. I don't know that they actually have to release the number of cases or deaths, but we are asking them to be transparent.
Why not? That's a fundamental question. Why not?
I mean,
So to clarify,
Why shouldn't
hold
Howie
on.
know?
So to clarify, you want to go to court over releasing the names of facilities. You'd rather this go to court and people fight for this information.
Because Florida and Tennessee.
We want.
Yes.
This is something that is very important. I think people put a lot of trust in us with their communicable disease information, and it is state law. So it is not HIPAA.
But Governor,
We want people to be able to make the most responsible decisions possible. We are treating the residents of these facilities as people. We are listening to them in terms of their next of kin or next of care. We're informing them. We're not informing the media.
So you may
Okay.
want to go to court over that.
Well, we don't want to go to court. I'm deferring to Dr. Christ on what HIPAA law is.
Governor,